8 Early Signs that Cancer is Growing in Your Body. Early signs of cancer can often be subtle, making it easy to miss the warning signals your body might be sending. Do you know what to look out for? Recognizing these signs is crucial, not just for early detection, but for timely intervention, which can significantly affect outcomes. Despite affecting millions worldwide, cancer's initial symptoms are still frequently overlooked or misunderstood. The challenge lies in how these signs can vary greatly from person to person, adding to their elusiveness. In an age where information is abundant but sometimes skewed by commercial interests, understanding the true early markers of cancer has become even more challenging. It's time to cut through the noise and focus on what really matters: clear, verified information that empowers you to take control of your health. Here, we will outline the key early indicators of cancer and help you interpret your body's signals so you know when it's time to seek medical advice. And before we start, don't forget to hit that subscribe button and turn on the notification bell so you never miss out on more tips to keep you healthy and active. 1. Persistent fatigue. Persistent fatigue can sometimes be one of the earliest indicators that something serious, such as cancer, may be developing in the body. If you find your energy levels have significantly dropped and neither sleep nor rest seems to help, it's important to take note. This kind of tiredness isn't the typical fatigue one might feel after a busy day. It's a deep, relentless exhaustion that doesn't ease up. Certain cancers, like leukemia or lymphoma, can be particularly linked with this persistent fatigue. These conditions impact the blood and bone marrow, disrupting the production of healthy blood cells and leaving you feeling constantly drained, regardless of your efforts to recover. Other symptoms, such as muscle weakness or confusion, might also accompany the fatigue. These can occur in cancers that alter hormone levels or cause internal bleeding, such as colon or stomach cancer. When cancer interferes with the body's normal systems, it often leads to ongoing tiredness and other related issues. Fatigue as a symptom can sometimes be overlooked or dismissed as stress or overwork. However, if this exhaustion is unexplained and lingers for an extended period, it's critical to seek medical attention. A healthcare professional can conduct tests to rule out or confirm underlying conditions that need addressing. Being attuned to your body's signals is crucial. While it might seem like a minor inconvenience at first glance, persistent and unexplained fatigue can point to a more serious problem. Paying attention to these signs and seeking timely medical advice can help ensure your well-being and provide the necessary care your body might require. 2. Persistent headaches. Persistent headaches, especially those that persist despite over-the-counter or prescribed medications, can be concerning. If you experience a headache that lasts for more than 2 weeks, it's important to consult a doctor. Such headaches could potentially signal a more serious underlying issue, such as a brain tumor or other forms of brain cancer. In addition to the persistent headache itself, other neurological symptoms may be present. These might include blurred or double vision, changes in hearing, or facial drooping. If these symptoms accompany your headache, it's crucial to seek medical attention promptly. Seizures or other unusual neurological events should also be evaluated by a healthcare professional, as they can indicate changes in brain function that require immediate attention. Brain tumors, for instance, can exert pressure on nerves and disrupt normal brain activity, leading to symptoms like these. Ignoring a prolonged headache and associated neurological signs can be risky. While the majority of headaches are not linked to cancer, those that resist standard treatments and persist for an extended period warrant thorough investigation. Early detection plays an essential role in improving the treatment outcomes and management of brain tumors or other related conditions. Paying attention to your body and recognizing when something feels off is critical. If you have a persistent headache accompanied by additional neurological symptoms, don't delay in seeking medical care. Being cautious ensures timely intervention and appropriate treatment. 3. Changes in urinary or bowel habits. Changes in urinary or bowel habits can be an early indication that something in your body isn't functioning as it should. For instance, experiencing persistent constipation or diarrhea lasting for several weeks warrants a visit to your doctor. While these symptoms might seem minor, they could point to serious underlying issues, including cancer. Altered bowel habits may also signal conditions like inflammatory bowel disease, such as Crohn's disease, but they can sometimes hint at more severe concerns, like colon or stomach cancer. These cancers often disrupt your digestive system, leading to noticeable changes in frequency or comfort during bathroom visits. Similarly, changes in urination, such as pain while urinating, increased frequency, or a weak urine stream, could be indicative of urinary tract issues. These signs might be related to an enlarged prostate, a urinary tract infection, or more critical conditions like prostate or bladder cancer. Identifying these symptoms early is crucial. While they could result from less serious conditions, they may also act as early warning signs of potentially life-threatening illnesses. Being proactive about your health involves listening to your body's signals. If you notice any persistent changes in your urinary or bowel habits, it's important to consult a healthcare provider. Early detection and treatment can make a significant difference in managing conditions such as colon, stomach, prostate, and bladder cancers. Addressing these symptoms promptly is always better than dismissing them and risking the progression of a treatable condition. 4. Unexplained or persistent pain without an obvious cause, such as an injury or illness, and that does not improve with standard treatments, should be assessed by a doctor. Pain serves as your body's warning signal that something may be amiss. If you experience lingering pain without a clear explanation, it could potentially be an indicator of cancer. For instance, abdominal pain in men might point to prostate, bladder, testicular, or penile cancer. In women, unusual sensitivity or pain in the breasts could be a warning sign of breast cancer. This type of pain is not typical and doesn't subside with over-the-counter remedies, hinting that a more serious issue could be underlying. Moreover, internal cancers can also manifest as chronic pain. For example, a persistent heaviness or swelling in the scrotum might be a symptom of testicular cancer. Similarly, ongoing abdominal discomfort could suggest conditions like liver or pancreatic cancer. Such pain is often underestimated or attributed to less severe problems, but it warrants thorough investigation. Ignoring unexplained pain can be risky. While it's easy to dismiss it as something minor, persistent pain unconnected to any known cause should never be overlooked. It requires medical attention to rule out serious health concerns. 5. Mouth sores that won't heal should never be ignored. Mouth sores that persist for more than a couple of weeks warrant serious attention. If you notice lasting sores, lesions, or white patches on your lips, tongue, gums, or other areas in your mouth, it's crucial to have them evaluated. These symptoms may signal oral cancer, a condition that can develop in various parts of the mouth, including the lips, tongue, and throat. Individuals who use tobacco or consume excessive amounts of alcohol are at a higher risk for oral cancer. Persistent sores are particularly concerning if accompanied by other symptoms like difficulty swallowing or unexplained weight loss. Additionally, white patches in the mouth, known as leukoplakia, can also serve as a warning sign. Leukoplakia is a precancerous condition that poses potential risks if it progresses untreated. While these patches may seem harmless at first glance, they require a thorough assessment by a healthcare professional to determine the proper course of action. Disregarding persistent mouth sores can lead to serious consequences. Oral cancer is often aggressive, but early detection greatly improves treatment outcomes. If you notice sores that fail to heal, don't delay in seeking medical advice. Prioritizing prompt evaluation is key to addressing these concerns effectively. 6. Blood in your urine or stool. Noticing blood in your urine or stool can be alarming and should never be overlooked. Blood in the stool may appear black, tar-like, or red, while blood in the urine can range from pink and red to dark brown. These symptoms may indicate serious conditions, including cancer. For instance, blood in the stool could point to digestive system cancers, such as colon or rectal cancer. It may also be associated with inflammatory bowel diseases like ulcerative colitis, which can disrupt normal digestive function and cause bleeding. Likewise, blood in the urine could signal prostate or bladder cancer but might also result from infections or other issues within the urinary tract. The presence of blood is a clear indication that something is wrong and warrants immediate attention from a healthcare professional. If you observe these symptoms, don't delay seeking medical advice. A prompt evaluation is essential to identify the underlying cause and implement appropriate treatment. Your health should always be a priority, and warning signs like these should not be ignored. 7. A cough or hoarseness that won't go away. A persistent cough or hoarseness lasting more than 2 weeks should be evaluated by a doctor. If you experience a dry, hacking cough that does not improve, it could be an early warning sign of lung cancer. Additionally, coughing up blood or bloody discharge is especially concerning and requires immediate medical attention. Hoarseness or a raspy, strained voice that doesn't resolve can also be indicative of a more serious issue. Voice changes, particularly when accompanied by difficulty swallowing or pain in the neck or throat, might suggest thyroid or throat cancers. While persistent coughing and hoarseness are often dismissed as minor issues, ignoring these symptoms can lead to delayed diagnoses of severe conditions. Chronic coughing, especially one that doesn't respond to typical treatments, is a common symptom of lung cancer. Pay close attention to what your body is telling you, and avoid neglecting persistent respiratory symptoms. If a cough or hoarseness lasts for more than 2 weeks, consult a healthcare professional to identify the cause and begin appropriate treatment. 8. Excessive bruising. Excessive bruising, especially in unusual areas of the body, can sometimes be a warning sign of underlying health issues, including certain blood cancers. If you notice bruises forming without any clear cause, it's essential to consult a doctor. Such bruising may indicate problems with your blood cells, such as leukemia. Leukemia interferes with the body's ability to produce healthy blood cells, which can lead to symptoms like frequent or unexplainable bruising. Bruises might occur on areas like the arms, legs, or other parts of the body where bruises are typically uncommon. This symptom should not be overlooked, as it could signal a more serious condition. Besides bruising, other symptoms to watch for include frequent nosebleeds or bleeding gums, which may also point to blood disorders or cancers. If you experience any of these signs, it's vital to seek medical evaluation promptly. Stay attentive to changes in your body, particularly unexplained or recurrent bruising in unusual places, and make sure to consult a healthcare professional for further assessment. Cancer manifests in various forms, and identifying the early symptoms is vital for timely diagnosis and treatment. Stay attuned to changes in your body, and consult a healthcare professional if you notice any concerning signs. Thank you for watching. If you found this video helpful, consider giving it a thumbs up and sharing it with others who may benefit from this information. Don't forget to subscribe to our channel for more insightful health-related content. Additionally, if you enjoyed this video, we think you'll appreciate the one suggested on your screen as well.